Okay, base of the first metatarsal. Okay, so base of the first metatarsal, the cuboid is right here. So here's our cuboid right here. If she has cuboid syndrome, then she would be tender here when I press. She may be tender on the top, but this is all where the cuboid is, right here. So this would hurt. You okay? Yeah. All right. This would hurt if she had it. So to do the manipulation, she's in about 70 degrees of knee flexion. One thumb is on the cuboid, my other thumb is on it. So I got both thumbs on the cuboid. And what I want to do is just kind of grab the forefoot. You see what I'm kind of doing here? I'm kind of just working it, like that. Okay? Just snapping a whip. That's exactly what it is. It's not a killer manipulation, but just kind of get it. I'm kind of mobilizing it while I do this, and then it's just a quick flick of the wrist in a downward direction for the manipulation. All right? She may or may not feel a snap with this. The majority of times that I've done it, they don't feel it. But when they get up, they're like, actually what they do, when you then press on it, they're like, that's not tender anymore. Okay? So that can be something you can do before and after. Is it tender now? She'll say, no, it's not as tender now. So that could be something that would be helpful. Halocrural distraction manipulation. What I would do here. This is for the patient who has limited ankle dorsiflexion. So let's say we have a patient who was immobilized for a long period of time. They had an ankle fracture. They're out of the cast. They just have a stiff ankle at this point. This is not done for pain. The other one is done for pain. This one is done for stiffness. So if you have a patient who does not dorsiflex well, we're gonna, and they may be limited in inversion and eversion too, but this is really a talocrural manipulation. So remember, talocrural joint is ankle dorsiflexion, plantar flexion. So this is a distraction manipulation. So what I'm going to do is I'm going to distract the talus and then give a little bit of a manipulation after that. Okay? So, Monty, can you do me a favor? Just raise the table up a little bit. I'm going to go steal a stool.
You want a stool or go over here?
Oh, right here. That's perfect. That's perfect. So you guys remember your mobilization techniques? Do you guys remember these? So I'm going to take the web space of my hand. So where is our talus? It's immediately underneath the malleoli. So if I just drew a line that went from tip of the malleolus to tip of the malleolus, right here is the talus. So I want to get into the talus. You're using the web space of your hand. You can use your pinky fingers here. You can use your middle fingers here. But you're trying to get as close to the talus, to the talocrural joint as you can. So you don't want to be down here. You want to be way up here. And I don't want her to be in full plantar flexion, and she shouldn't be in dorsiflexion. So she should be kind of in a more of a neutral position. And I'm just going to give some distraction so she can feel the distraction. So I'm taking up all the slack here, and then just like that. So it's just that and a quick. How do you do the other side?
Which way do you just pull straight back?
Straight back. It's just straight back. So it's a grade 5 mobilization. You do it one time. Some of you guys in here will cavitate.
You can do this for like what? Adhesions?
Yeah, exactly. That's exactly when you would do this.
And you wouldn't.
So let's say.
Like if there was a rod or anything, obviously.
If they have a rod in their fibula, that's not affecting. No, I mean if there's nothing that's purposely limiting their dorsiflexion, then no. I mean if you have okay, now I want to get this at the right level. And I guess if you guys do have can I have that towel?
See lefty. The other left.
All right. Now, just like Maitland, we're going to find our comparable sign or an asterisk sign. Remember that? Do you remember what that is? This is our before and after test. So all I want you to do, I'm just going to have you just dorsiflex for me. Just bend your knee forward. Bring your leg forward. Put your foot down. So that's all he's got. Okay? So what I'm going to do here is I'm using my web space of my hand. I'm going to mobilize the talus posteriorly. Okay? No, don't you do anything yet. I'm going to push this posteriorly. You feel okay with that? He might be a little tender, but is it just where I'm touching? Because the other thing I can do, like what Jack has too, is a little bit of padding or whatever. All right, if he can't tolerate it, you can take a little sponge or something and put that over your hand. But just so you guys can see, I'm in here, and I'm pushing straight back. So you're okay with that? All right, I'm going to mobilize you back. Now what I'm going to do is as he bends his knee, I'm going to come down. So go ahead, and I'm pulling on the belt. I'm leaning back on the belt. So go ahead and bend your knee. Come as far as you can before it hurts. You okay?
It hurts a little bit, but
Okay. Come back up. Okay? See how much more range he's got there?
big difference.
A lot of difference. Let's do that several times. So this is the technique. I push with my hand, I pull with my belt, and he comes down. The thing I want to try to do too is as he bends his knee, I want to drop my butt so the belt is always kind of at a right angle to his tibia. Okay? This is why you can't dress really nice when you go to work anyway, whatever. So let's do this. We're going to do this 3 times. The rule for you, though, is that this cannot hurt. This is not one of those things where you want to work into the pain. Because that's a mulligan thing. Mulligan is all about the techniques needing to be pain-free. So if it hurts, we don't do it. This is the other thing, is if it hurts, so if he doesn't get down too far and it hurts, then what Calvin will do is tweak the angle of his knee. So instead of him coming straight forward like this, I might say, come a little bit to the side or come a little bit to that side. And that's what I was talking about in terms of finding that sweet spot. Okay? So let's do it. You ready? Now hold on a second. I mobilize. Okay, go. You good? All right. And then come back up. You go as far as you comfortably can, okay? Again. Good? Okay. What's stopping you?
I stop at the pain.
Okay. Come again.
I'm stopping where it starts to hurt because I don't want the pain.
Okay, good. Now let's stand up. Okay. And let's retest. Okay. What do you think? That's better. That's definitely better. So now, what we can do, so we should take his fibula. Would you do that? At this point, maybe?
Yeah.
We could do a fibular taping. And let's just show that next too. All right? What our goal is now is to kind of keep this. And what we want Calvin to do is to keep working on dorsiflexion so he doesn't lose it. So Calvin is going to go home with kind of a dorsiflexion stretch exercise. But the other thing we're going to do is we're going to tape his fibula back. All right? Because again, Mulligan thinks that one of the reasons why he's having pain in this pinching is the fibula is just sitting too far forward. So I'm going to push it back. So on this one, and because it really is Calvin, because he's a real patient, I'm going to use we'll just use the white tape. I'm going to use the white tape and the brown tape. So I'm going to go grab some white